Are you turning 65 or going to Medicare soon? If you are, then you've probably been doing some research trying to figure out exactly what plan is right for you. And what you've probably figured out is that there are all sorts of different types of plans out there. But one that you've probably come across the most, or at least very often, is what we call a Medicare Supplement Plan G. It's the Medicare Supplement Plan G. And yes, it is the rave of Medicare. The Medicare Supplement Plan G is the most popular Medicare supplement plan on the market. What that means is that most Medicare beneficiaries who buy a Medicare supplement plan are getting the Medicare Supplement Plan G. And so what I want to do in this video is I want to talk about why the Medicare Supplement Plan G is the plan that everybody is getting. Why is the plan that everybody is getting? Thank you for joining our page and joining us for this video today. We are your 65 Compass, and I want to start by saying this before I get into really what we're going to talk about. I want to say that nothing will ever replace the fact that you need an agent to guide you. So please watch this video, get some great information, but remember, you can get in contact with us by following the information in the description of the video below, and we would have an agent that would love to talk to you about your plan options today, including the Medicare Supplement Plan G. Now, the Medicare supplements exist for one very obvious reason, and that is Medicare has some out-of-pocket costs. Original Medicare has some out-of-pocket costs. Now, when you get your red, white, and blue card in the mail, you will see that your Medicare card, your red, white, and blue Medicare card, has two parts on it. That's Part A and Part B. Part A is your hospital coverage, and then Part B is your medical coverage, but they are together, they make up Original Medicare, and that's what's on your original red, white, and blue Medicare card. Now, there are some out-of-pocket costs associated with Original Medicare. That's actually why my role exists, why our company exists, why Medicare brokers exist. We are here to help and guide beneficiaries just like yourself in this Medicare journey that can be very, very complicated. And there's a lot of out-of-pocket costs that you're not even considering that you should considering. Well, what do those look like? Well, we have deductibles, copays, coinsurances. Those are the primary out-of-pocket costs that you see with Medicare. The deductible being the amount that you have to pay before insurance will pay anything. So if I have a $200 deductible, I must pay $200 out of my own pocket before Medicare will pay anything. If you have a copay, that's a flat rate that you pay for each service. And then if you have a coinsurance, that's a percentage that you will pay for each service. And Medicare A and B, Original Medicare, is made up of deductibles, copays, and coinsurances. Let's start with our Part A deductible. So Part A is your hospital coverage, meaning that room and board. If I stay somewhere, inpatient is the best way to say it. If I have an inpatient stay, an inpatient service, that would be covered by Part A. And I do have a Part A deductible. And for this year, that is $1,736. That's what my Part A deductible is. What that means, quite simply, is that if I were to go to the hospital, I would have to pay $1,736 out of my own pocket before Medicare would pay anything. Before Medicare would pay anything, that's what I have to pay out of pocket. And that's not one time per year. Most deductibles are annual, but this is actually once per benefit period. So if I were to be put into the hospital and then I was later released and then I went to the hospital 2 months later, well, guess what? I could end up paying that out of my pocket all over again just 2 months later. And there is no max out of pocket there. Then I have Part A copays. And the way I want to explain this is just, I'm going to make it as simple as I can, is that the Part A copays are a copay that I could pay per day that I'm in the hospital. And it doesn't start necessarily here, but these copays can eventually get up to $800 a day that I'm in the hospital. I could be paying that amount every single day. $800 a day is what it gets to. But there's a tier system. In the beginning, it's $0 a day, but then after so many days, it goes up to $400+ a day, and then eventually it gets up to $800 plus a day. And then actually past that, it gets to the point where the hospital expenses are completely out of your pocket. It's 100% your responsibility. So that can be very, very that could be very inconvenient, if you will, out of your budget, especially when you're talking about $800 a day. And then we have a Part B deductible. So Part B is going to be your medical. So anytime there's an outpatient service done, Part B is what's going to foot the bill. And this Part B deductible is $283. That's $283. The good news is that is an annual deductible. I mean, you only pay that one time per year. So if I were to go to the hospital, if I were to go to my doctor, I would actually pay this $283 out of my pocket before Medicare would pay anything. And so I would pay that out of my pocket. Then once that's met, I wouldn't have to meet that again, which is a lot simpler than the $1,700 deductible on Part A that could be paid up to, I guess, really 6 times a year. After my deductible, though, on Part B, I do have an 80-20 coinsurance. I have an 80-20 coinsurance. What that means is Medicare will pay 80% of my bills. I would pay 20%. So if you're a beneficiary on Medicare and you have a heart surgery done and it's a $100,000 heart surgery, you would be responsible for $20,000 of that bill. And that number can be as little as $20. It can be all the way up to $2 million. Whatever, it's 20% of whatever you end up spending on a service you would be responsible for. Now, the thing that is most alarming about these costs with Original Medicare is that there is no what we call MOOP, or that stands for max out of pocket. There's no maximum out of pocket. Most insurances have a maximum out of pocket, meaning that there's some kind of cap or stop loss that they would pay, the beneficiary would pay, and then the insurance would completely take over from there. Your employer coverage is probably something like that. Maybe there's a max out of pocket of $7,000, which means that if you paid $7,000 worth of your own money towards medical services, hospital services in a year, your insurance would pay everything from there on out. You wouldn't be responsible for a dime. So there's a cap that you could spend in a year. With Medicare, there is no maximum out of pocket. It is completely unlimited, meaning that all these can add up to $1 million or more if you were to have some kind of catastrophic event in that year. And I know nobody's prepared for that. So there's really 2 directions that beneficiaries will go in order to avoid these out-of-pocket costs, especially that no maximum out-of-pocket. The way they would do that are 2 different ways. The first one is to stick with your original Medicare and get a Medicare Supplement Plan. And we're going to talk about that one primarily for the next few moments, including the Plan G, which you're most interested in seeing today. And the other option is to go Medicare Advantage, where you would give up your original Medicare and now you would be on a private Medicare type of plan that has networks and prior authorizations. It's managed care, meaning that the insurance carrier would dictate how your health services are operated rather than your doctors and yourself. A lot of the decisions would be made by the private company rather than you. And so a lot of our customers prefer to stick with original Medicare and get a Medicare Supplement Plan. And the one that we're most interested right now in is the Plan G, but I want to talk about the 3 popular plans that are most commonly available for beneficiaries, most commonly available. I got Medicare Supplements, and they have letters to them. So these are going to be lettered plans. We have Plan F, we have Plan G, and we have Plan N. Plan G being the one that we will spend a lot of time talking about here. But we have Plan F, we have Plan G, and we have Plan N. And these plans are going to do a very good job of covering those out-of-pocket costs. If you actually go back here and count these, I have 1, 2, 3, 4 different out-of-pocket expenses that I already went over. And then I have one more, which would make 5, called excess charges, and I'll discuss that later. Excess charges. These are out-of-pocket expenses that I could run into. So I have 5 gaps to my Medicare coverage. Well, these Medicare supplement plans are going to do a great job of filling in these gaps. And we're going to start with this one, Plan F. Plan F is simply going to do this. It's going to cover 5 out of 5 of the Medicare supplement gaps. That's what it's going to do. 5 out of 5 of the Medicare supplement gaps. In other words, it's going to pay 100% of your bill, or I should say your share. Your share. Medicare will pay its share, and then Plan F would pay your share. Now, You may be thinking, well, why is that not the most popular plan? Why is that not the one everybody's on? Well, I'll keep it pretty simple for you. And it's for this reason right here. If you were eligible for Medicare after January 1st of 2020, you can no longer get on a Medicare Supplement Plan F. It's no longer available for you. You can't enroll into that plan. You had to be eligible for Medicare prior to this, and that means either Part A or Part B was effective before January 1st of 2020. If either of those effective dates were after the fact, you would not be able to enroll into a Plan F plan. And so what we're seeing here is 5 out of 5 are covered. Maybe you are somebody who's eligible because your effective dates are prior to this. You can be on a Plan F and it would cover everything. Medicare would pay its share, Plan F would pay your share. It's that straightforward. Now, of course, since it is the most comprehensive one of the 3 we're going to talk about, it is the more pricey one, if you will. Plan G is going to cover it's going to cover 4 of the 5 gaps here. The ones that it's going to cover are going to be your Part A deductible, Part A copays, your Part B coinsurance, and then excess charges. So 4 of the 5 gaps are going to be covered. The only thing that would not be covered is your Part B deductible. Your Part B deductible, which means that on Plan G, Medicare would pay its share, Plan G would pay your share, except for that Part B deductible, which was only $283 per year. So everything else, hospital and medical, would be completely covered, and then you would pay your Part B deductible of $283. Imagine having a plan that all you had to pay was a $283 maximum out of pocket. That's a phenomenal health coverage to have. It's very, very comprehensive. It's very convenient, and all of our customers love their Plan G very, very much. And the good news is that all new Medicare beneficiaries right now are eligible for Plan G, and that's not going away anytime soon. So unlike Plan F, I can get onto a Plan G regardless of when my Medicare is effective, which is great. And then I have Plan N. And on Plan N, what I'm going to see is that 3 of the 5 of those gaps are covered. The ones that are not covered are my Part B deductible and excess charges. Excess charges. So on Plan N, I would be responsible for my Part B deductible, which is $283, and then I could be responsible for excess charges. Now, what are excess charges? Well, every year, Medicare releases something called the Medicare Physician Fee Schedule. And that fee schedule is going to have every service that you can imagine listed on it. And Medicare, they list all these services at a price point that they're willing to bill that service. For example, a flu shot, they may list that at $100. That's what Medicare is willing to pay towards that service. And every service you can think about is on that fee schedule. Now, doctors who are going to take Medicare, that are going to be in the network for Medicare, they have to follow that fee schedule. Good news for you is 99.9% of doctors are accepting Medicare, therefore they have to follow that fee schedule. And they obviously have to bill at that fee schedule as well. Now, the thing that you need to keep in mind is that they are allowed to charge 15% over that Medicare policy fee schedule. That's what we call an excess charge. So that excess 15% that they can charge you is an excess charge. Plan F and Plan G will cover it. Plan F and Plan G will cover excess charges. Plan N will not. So Plan F is not the most popular one just because you can't get into it anymore unless you were already on Medicare. Plan N is simply not the most popular one because there is a gap there that you could run into, not to mention you could have copays for doctors and for your ER, though they are very manageable and very convenient. And Plan N is a great option. All three of these are great options, but the one that kind of falls, what we call maybe in the middle here, is the one that most people go with, and that's a Plan G. It's going to give you great coverage, very convenient coverage, because it's a Medicare supplement. There's no doctor networks. There's no prior authorization. I don't have any managed care. I'm able to use my plan as I please, and it's going to pay as long as Medicare pays, which is going to be every time you go get a service done. And then, of course, what our customers love to do is they love to get additional drug coverage, additional dental, vision, hearing coverage, because Medicare doesn't cover those things either. But with that Plan G, you're going to cover so much of your hospital and medical out-of-pocket costs that you'll be so thankful that you had that coverage. Now listen, if you're interested in this Plan G, you want to talk more about it, please follow the information in the description of the video below, and we will get an agent that wants to talk to you today about the Plan G so that we can get you set up and right on track for your Medicare journey. We are your 65 Compass. We want to help you through your Medicare journey today.